Welcome to our podcast. My name is Ruth Barron, and I'm here with Melitta Basa, Vice President of Clinical Services for Enterhealth, a behavioral provider of mental health and addiction treatment services. Today we're going to talk about anxiety and depression. So, what are some of the maybe lesser known tips that would be valuable to share with people about anxiety and depression?
There are a lot of great tips that I can share with you guys today. But first and foremost, I think a lot of people don't recognize when they're having anxiety or depression, and we can often think it's something else that's going on with us. But I think understanding what those symptoms are, maybe we're feeling like less motivated, and normally we're a little bit more motivated, or our sleep cycle is off, or we are just not feeling that urge to go and do something. Eating habits change, sleep hygiene changes. With anxiety, a lot of times people confuse it with a heart attack, which is crazy to even think, right? That we would go to a medical versus a mental health. But those are common things among the two. So some tips that, if you recognize that maybe you have racing hearts, maybe you're feeling a little sweaty, maybe you're feeling like you're overthinking things a lot, racing thoughts, that type of thing. Grounding techniques are really great. There's a variety of them, but one of my favorites is you do the 5 senses. So you'll start with, I always show people, you could do hearing, right? So 5 things you can hear, 4 things you can see, then what you can smell, 3 things you can smell, 2 things you can taste, and then maybe 1 thing you can feel, or you can do it vice versa, however. But I always show people that little trick there is a great way to remember. Breathing techniques are always a good go-to as well. We just want to do anything that brings us back into the moment. So if we are breathing, we want to make sure, I like square breathing a lot. Square breathing, you could do 6 breaths in, hold for 6, down for 6, and hold for 6. So you can do that, in a meeting, right? You could just start drawing a square and start doing your breathing. If breathing 6 is too long, you could also do 4. 4 breaths in, hold for 4, and 4 breaths out. But we want to bring ourselves, like I said, into the moment and making sure that the present moment is here and now, and we're focusing on anything that can get us there.
That's very helpful. I'm going to remember the breathing.
Oh, belly breathing's really good too. So if you were to breathe in, you feel your belly expand like a balloon, and then exhaling, you bring your belly button to the spine. So feeling it deflate. Yeah. So a lot of times we do chest breaths when we're anxious or even feeling depressed. So we want to go to the belly. It actually clears everything up for you.
Wow. Mm-hmm. So what are some ways that we can support friends, family, coworkers who may be struggling with depression and anxiety?
If we're aware that they are, and there's a couple things you can look for, but if they're actively telling you that, I think the first and foremost is just listening, right? Listening can go a long way. It tells you that the person cares, that they're there for you, and then maybe they're more willing to seek help. I think when we're struggling with anxiety or depression or something else, sometimes it's first difficult to even verbalize that and say that out loud. So that's first and foremost. So if anyone shares that with you, the last thing we want to do is be distracted or be dismissive. If you are struggling with that yourself and that might trigger you, hearing that, I think the best thing is to just reflect back, of what you're hearing them say, and just listening completely to what they're saying rather than going to our own past experiences or maybe even current experience. I think education is huge too. So if you are aware of what anxiety and depression are, then what are ways that they can seek help, sharing those ways with them, and even providing some resources if you have them.
So really being present for somebody if you know that they're struggling.
Yeah. And if you feel like you see those signs and symptoms in them, it doesn't hurt to ask, hey, are you struggling with something? I'm noticing this. So a lot of people tend to, take the avoidance route of that and not ask those questions, but it's better to ask than not.
Oh, that's a good point. And then, of course, Enterhealth.com.
Of course, yes. Enterhealth is obviously a great resource for mental health, but also addiction. If you're struggling with both, we have both of those programs available. So I really want to encourage people to take a look at that from outpatient level all the way to an inpatient level. And everyone has different needs. So if you're not sure what your need is, you can certainly call our 1-800 number, and on there, someone will pick up. So it'll be a licensed professional that'll help you get to the place that meets your needs the best.
Great. Mm-hmm. And you're doing a webinar on the same subject.
Yes, so please join us.
You can register on enterhealth.com, look for events and webinars, and you can fill out that form and then hear more from Melitta then. If you need any more help or assistance about depression and anxiety, you can reach out to our experts at Enterhealth by calling 800-388-4601 or visiting enterhealth.com. Our intake specialists can answer any questions you might have about understanding or overcoming depression and anxiety.